na walang lisensya?
Because there is lack of motivation also to take the exams immediately.
Hindi nga, pero pwede na silang magtrabaho as a nurse.
No.
Hindi rin.
Aha. Yung
Oo nga
it,
marami tayong mga nakikitang mga perspective ngayon. That's good.
Halimbawa, for example, why will I take the review now or take the board exam? When later, even if I pass the board exam, wala rin naman akong employer sa hospital. In fact, I know some people na board top-notchers who are not even accepted or employed in a hospital. Simply because punong-puno na yung...
Okay, if that is one aspect you want to bring out, what about yung sinasabi nila is the quality of the nursing school and the nursing curriculum?
Well, pag titignan naman kasi, yung pumasa sa first taker is 57%.
Good.
So that's a very good percentage. Ang nagbabalang talaga dyan is yung retaker na 26% lang. So, na-pull down talaga eh.
Okay. Carl, if you are in the review center, kayo ang dahilan na hindi nyo na-review ng mahusay, kaya mababa rin ang review passing.
Alam mo, nung tinanong nga ako bakit nung unang panahon pumapasa mga nurses?
Walang reviews.
Kasi number one, gusto naman nila talaga maging nurse noon. Ngayon, gusto ng nanay at tatay nila. So, the motivation of becoming a nurse, you cannot learn something you don't like to begin with.
Okay.
Ngayon, kasalanan ba ng review centers na yung mga repeaters bumagsak pa rin. Ang tanong, nag-review ba talaga yung mga repeaters na yan? Number two, kung nag-review nga sila, ano bang qualification ng review centers nila? Review centers is actually not regulated.
Hindi sila bahagi ng CHED.
It's a non-regulated industry. As a matter of fact, ang daming fly-by-night. And this is actually why we're coming out now.
Okay.
Parang gusto namin tawagan, government, please regulate us.
Okay. And talk to the government. He's right here. CHED, let's just go basics here. Yung number of nursing schools that give the 4-year, 5-year ba ang nurse?
4 years and 2 summers now.
And 2 summers, college degree. Kayo ang nagre-regulate.
Yes.
Okay, give us an idea. How big is this nursing education community?
It's more than 400, actually around 460. That's the number now. No? So, ang tingin namin, masyadong marami at masyadong malaki ang enrollment. No? Maraming factors yung tina kung ba't nangyari yan eh. Yung myth na, to the nursing profession, it's your way out to poverty, mayroong trabaho abroad, everywhere, no? So doon masyadong naging popular, napakalaki ang enrollment, and when there is that great demand, you cannot help but schools will proliferate. So meron tayong moratorium in the opening of nursing schools, but just the same.
Moratorium, kailan inumpisahan?
Matagal na yun.
So wala nang nagbubukas na nursing school
ngayon?
The
only exception is when you have a hospital. When you have your own hospital.
Primary hospital.
Tertiary. That's the only, but that's very expensive. So right now, our target is to go after the low-performing nursing programs, and as much as possible, after giving them, a 2 or 3 year grace period, we'll face them down.
Okay, itong mga 460 na sinasabi niyong nursing schools, ilang taon na sila nag-ooperate?
Well,
average?
Average siguro, maybe 5, 10. Yung karamihan, because in the last 10 years, biglang dumami. There was a time na wala pang kalahati yan eh. But because of the worldwide demand na sinasabi nila, up to now, napakataas ang enrollment ng nursing and health-related professions. Number 2, next to the business-related courses. So what we're doing, we're trying to encourage students, even the institutions, to refocus yung kanilang courses. Kasi nagdi-dwindle na yung dito.
Hindi, okay. Kung yung average nyo mga 5 to 10 years, nag-ooperate na sila, meron ba kayo in your history as CHED regulating this nursing sector, may sinara na kayo? At kung ilan ang sinara nyo, for what reason?
In the last 10 years, I would say around 10 to 15 ang nag-voluntary phase out.
Voluntary phase
through
out.
Through regulation, at the same time, through yung siguro problems of enrollment also.
Okay, voluntary yun.
Yes, now,
so yung act nyo, as the one closing down, meron na kayong ginawa?
Well, we're starting. We have issued the notice late last year. And we have found out around 152 schools are performing below the national mean or the national passing. And we have warned them.
Okay. Kung national mean, ano yung criteria ang tinitingnan nyo? Are these the 3 areas? Curriculum, facilities,
Well, that's
and
only in the
faculty?
licensure examinations.
In the licensure. Pero as a school?
Yes, we look at the quality of the instruction or the faculty qualifications. Then the facilities, and of course the presence of a learning or base hospital. And then the appropriate laboratories. And of course our curriculum now, it's been developed recently, and it's been benchmarked with the other countries. And our technical panel for nursing would say that this is a world-class curriculum. But the problem is in the process of implementation.
Yeah, it's a world-class curriculum. You said na you comply with the standards of the world, but yung sinasabi nga niya is implementation of these standards. Where does it fail? In the teaching staff? Saan nagkukulang kung we are always bragging na, ka-standard na natin lahat ng mga nursing schools all over the world? Saan tayo nagkukulang, Commissioner?
Pwede ho yun. Sinabi ko nga ho kanina, isa sa mga components ay yung quality instruction or quality teaching. Base ho kasi, Tina, sa provision sa aming batas, yung Nursing Act of 9173, nakalagay doon ang kwalifikasyon para ikaw ay maging faculty member ng isang nursing school. Una, kailangan meron kang master's degree. Okay? And ikaw ay nakapag-experiensya na maging isang nurse, hospital man o for 10 consecutive years. So, sa dami ho kasi, we have 46 nursing schools in the country. Siyempre, marami masyado ang estudyante. So, nahihirapan hong humanap o mag-empleyo ng guro o instructor na merong sapat na kakayahan at kwalifikasyon.
Okay, so dinami-dami ng nursing school ngayon. Ibig nyo sabihin, yung mga nagtuturo ngayon do not meet the standards of
Some
masters
of them, yes.
and 10 years of
Yes.
being a nurse?
Yes, yes.
Paano sila nakakapagturo?
Meron hong merong eskwelahan na o-off lang, kakukuha lang nung kanilang professional ID card and certificate of registration, they're already being hired. Kasi nga ho, lamang ang registered nurse na merong master's degree.
So kayo ang tumitingin doon sa kwalifikasyon ng teachers o yung professor?
Actually
yung
ho,
PRC?
No, both po. It's a joint ocular inspection. Ang mandato ho kasi ng Board of Nursing under the PRC is to inspect and visit schools para ho makita kung sila po ba ay sumasang-ayon doon sa standards na sinet po ng CHED, ang kanila bang faculty tumutugon doon sa provision ng aming batas, yun. At kung meron pa silang sapat na fasilidad, laboratories, para naman talagang lahat ng kanilang mga estudyante